Sometimes when patients come to see me, they're very concerned because they've heard that hormones cause cancer, particularly breast cancer. Now, this common misconception seems to stem from a study that was done in 2002 called the Women's Health Initiative Study. Now, the patient population in that study was postmenopausal ladies between the ages of 50 and 79 who had never been on protective hormones before. The investigators then took synthetic estrogen or synthetic estrogen and synthetic progesterone and gave them those drugs. They followed those patients for years. The synthetic estrogen patients had no increase in breast cancer. Unfortunately, in the patients who got the combination, there was a small but statistically significant increase in cancer. When that study got published, the whole community got upset. Both doctors and patients became very suspicious. The hard part about medicine is trying to interpret data. And when we look back at the Women's Health Initiative study, it had a lot of flaws. The two biggest flaws was one, the patients they chose, and two, the drugs they chose. Let's talk about the patients first. Remember, these were postmenopausal ladies. Some of them had not had hormones for over 20 years. What do hormones do for you? They keep toxicity and inflammation down in your system. So the fact that these patients had been without their hormones for years made them a very vulnerable group to begin with. The second was the choice of synthetic drugs. Now, synthetic drugs are man-made and mass-produced. They are made from foreign substances and foreign fillers. What happens when you give something foreign to the body? It causes inflammation and toxicity. And these poor patients didn't even have hormones to help them combat that. So it makes sense that with that inflammation and toxicity, they're going to be more susceptible to cancer. When you look at a study, you have to understand it. And that's one of the things we do well at Body Shapes Medical. I have the time to read and interpret. We only use bioidentical hormones for that reason. Bioidentical hormones are natural. A pharmacist takes natural products from plants and yams. He takes those molecules and transforms them into the molecules that are estrogen and progesterone. When we give your body back those, they think that the body thinks you're 25 again, and those are the natural hormones. But most importantly, they're not toxic. So now you have your warrior hormones to combat things as you go forward. Most importantly, at Body Shapes, we try to get people on them before they're off of them too long. So getting them as soon as your hormones decline restores those levels and gives you that extra bolster to your immune system. It's not fair to take a study and try to compare apples to oranges. You have to understand what you're reading. And that's what we do at Body Shapes Medical. We understand the literature and we keep up with it. So if you want someone who knows what they're doing to manage your hormone health, check us out at Body Shapes Medical. We're going to make you feel good, but most importantly, make you healthy.